one thing that's very disturbing that I think we should probably talk some more about, and it's an increase in overall mortality. The increase in overall mortality is pretty unprecedented, correct?
Yes. So this has been going on, has been in the news or getting some attention certainly for the last several months. And when you look at excess deaths, a significant proportion of those, if not most of them, are usually cardiovascular, heart attack and strokes, obviously my area of interest. The question is, what's causing it? And with heart disease, of course, cardiovascular disease, it's a multifactorial, condition. Some of it for sure, and I actually predicted this interestingly before the vaccine came onto the scene in my mind. I knew that because of lockdowns and the psychological stress associated with it and people's diets getting worse and being sedentary and stuff, I predicted that there probably would be, over time, an increase in heart attacks, certainly more vulnerable people. And I think there is definitely a role to be played there, Joe, in this.
Also, drinking, much more people drank during the pandemic. Alcoholism increased.
Yeah, these things will absolutely, and mental health obviously got worse. So,
Yes.
There's going to be people. I haven't looked at this, but I suspect some of these are going to be people with suicides have gone up, that kind of thing. I'm sure that's going to probably be a contributing factor.
Lack of screening and medical attention during that time.
A little bit of that. Not so much, because I remember I said that, modern medicine itself, only gives marginal benefits actually to most people. I think the emergency care stuff, for example, people not getting, timely treatment in emergencies for sure, like people having cardiac arrest, etc. But then what's driving the increase in cardiac arrest, which we've seen, right? So that's the question. So what proportion of those excess deaths are because of the vaccine? And there isn't much data out there that's reliable. But Professor Norman Fenton is a professor of risk at Queen Mary University, emeritus professor of risk, very well published, very respected mathematician, statistician, professor of risk. He did a recent article online, and his estimates in the UK, and you can extrapolate this around the world if you like, in terms of the excess deaths that have occurred since, say, 2021, he suggests that maybe half of those are because of the COVID vaccines.
Now, when we're talking about excess deaths, what are the numbers?
Well, in the UK, absolute numbers are about 120,000 excess deaths since 2021. And
what is the percentage over a normal year?
I can't tell you off the top of my head, Joe. I can't.
Okay.
I can't break down the percentage specifically for you. Separately in my paper, one thing I looked at was the increase in out-of-hospital cardiac arrests that happened in 2021 after the vaccine rollout versus 2020. And that was in the region of something like 14 to 20% increase, which was, quite significant.
And is it universal or is it uniform in all the states that rolled out these vaccines, this increase in excess deaths?
Yeah, the problem is the data is not collated that, we have to rely on what government figures. So certainly in the UK, it does seem to be pretty consistent in most places. Is it
proportionate to places where there was a very low number of vaccinated people?
Yeah, so if you look at across countries across the world, there is definitely a correlation with highly vaccinated countries and excess deaths. The one caveat, though, which is interesting, and I can explain that, is there hasn't been any significant increase in excess deaths in Sweden, and they're very highly vaccinated. Now, although the excess deaths are maybe one of the lowest in the world, they're still probably higher than you would expect after a pandemic, when a lot of vulnerable people would have died, and therefore your excess death rate should be in the negative, and they're not in the negative. So that means they are still higher than you would expect. And I've been to Sweden and given lectures there and spoken to cardiologists, and they are seeing these vaccine injuries. So why is Sweden doing better? As I said earlier, a lot of the vulnerabilities to vaccine injuries are people who had poorer baseline health, the same people who are vulnerable to COVID. A lot of the excess deaths are still also in the countries which had high obesity rates. So looking at COVID, and let's not underestimate or forget about this, 90% of the deaths globally from COVID happened in countries where more than half the population were overweight or obese. And when you understand the mechanism of harm of the vaccine, which is basically increasing inflammation in the body systemically for a number of months, if you've already got a baseline problem of a little bit of chronic inflammation, it's just going to make it worse. So it makes sense from a biological perspective why people who are also vulnerable to COVID are also more vulnerable to vaccine injuries. And Sweden's baseline health is a lot healthier. You know, a lot of the Scandinavian countries, they are generally healthier. They have lower social inequalities. There's something very interesting is that the bigger the gap between the rich and the poor in countries, that's a big risk factor for ill health as well, because there's something called status anxiety, Joe. When you have a big gap between rich and poor, everybody is comparing themselves to each other. And in these more and that causes stress, chronic stress. It's an element. There's a lot of interesting research on this. Whereas in the Scandinavian countries, they're much more equal societies socioeconomically, and that probably also makes them less stressed and healthier.
That makes sense, clearly. And also dietary choices, health choices, the stress, drug abuse that oftentimes comes with impoverished people.
Yes.
Yeah.
Absolutely.